community hospitals, dozens of specialized institutes and centers. We also have skilled nursing and assisted living facilities and home care services. And we are one of the largest mental health systems in the state. Now back to the community service plan, which, as you know, is required by New York State Department of Health and the IRS, and must be done every 3 years by our hospital in collaboration with community partners and the Department of Health. So for us, this was a culmination of a year-long community health needs assessment process with 2 work groups. One, the Ulster County Departments of Health and Mental Health, in collaboration with the Hudson Valley Public Health Collaborative, or HVPHC, which made up of the 7 counties in the Hudson Valley region, and Siena College Research Institute, which conducted a phone and online surveys of residents to gather their experiences, perceptions, and thoughts on what influences their health and well-being. Siena College also conducted a community provider survey of health and human services provider who serve underrepresented populations in the county to identify issues that could affect optimal health outcomes for residents. Key findings are then incorporated in the region-wide comprehensive health data report published by the HVPHC, the 2022 to 2024 Mid-Hudson Regional Community Health Assessment. Health Alliance also joined the Greater New York Hospital Association, or GNYHA's, 2022 Community Health Needs Assessment Collaborative, which supported participating hospital members' primary data collection efforts by gathering information on community health needs and engaging with community members. A diverse group of GNYHA member hospitals across the state participated in the collaborative, including community and safety net hospitals, small health systems, and large academic medical centers. So through our work led by the Ulster County Departments of Health and Mental Health, we reviewed and analyzed secondary data sources, including federal, state, regional, and local data, to identify trends and patterns that influence or result in poor physical and behavioral health outcomes for Ulster County residents. As previously mentioned, our primary data collection and analysis activities were conducted by Siena College, which resulted in a sample of 5,699 responses for the Mid-Hudson Regional Community Health Assessment Survey, 647 of which were from Ulster County, and 40 responses from the Community Partner Survey. In our second work group led by GNYHA, we developed and disseminated the Community Health Needs Assessment Survey and collected 17,600 responses, 331 of which were from Ulster County. At the conclusion of the CHNA process, the key findings below emerge for Ulster County, and we focus on the second and third bullets. A high percentage of children and adults who are overweight or obese, which we will explore further in the next slide, and an unacceptably high rate of maternal mortality. It is noteworthy that with the exception of the 5th finding about violence, which was only included in the GNYHA community survey, both community-based surveys concur on all Ulster County's residents' health needs. In addition, the provider-based survey conducted by Siena College also agree on the identified SDOH needs for the county, all of which confirm their significance. A deep dive into bullet 2 from the previous slide found that diabetes mortality and hospitalization rates are high for Ulster County, even though the incident rate is among the lowest in the Mid-Hudson region, and that the percentage of adults age 45 plus who have had a test for high blood sugar or diabetes is lower than those of the Mid-Hudson region and New York State, excluding New York City. Health Alliance then crosswalked the results of the CHNA against the prevention agenda priority area selected by the Healthy Ulster Council, proposed interventions by fellow council members, and the hospital's areas of expertise, priorities, and available resources. Ultimately, Health Alliance chose the following New York State prevention agenda priority areas. Priority 1, prevent chronic diseases with focus area 4. Preventing care and management with the goal of promoting evidence-based care to prevent and manage diabetes and prediabetes. Our priority 2 is to promote healthy women, infants, and children with focus area 1, with the goal of reducing maternal mortality and morbidity. This slide shows our primary service areas by zip codes and Ulster County demographic data based on the US Census from 2016 to 2020. Ulster County has an older population compared to the US and the state, with a median age of 44.1, and about 1 in 5 people are age 65 and over. Ulster County also has lower education attainment rate, lower employment rate, lower median income, and lower broadband internet access, while the county has higher poverty and disability rates. Now I want to share some of the support data for our selections of the 2 public health priorities. So according to the county health ranking and roadmaps, in 2022, Ulster County ranks 25 out of 62 counties in New York State for overall health outcomes, with 1 being the healthiest. Within the region though, Ulster County is the 2nd lowest ranking county. In the prevention of diabetes and pre-diabetes, notable areas that could be improved include premature death, especially among Blacks, which is significantly higher at 9,400 per 100,000. Adult obesity, smoking, percentage of low-income individuals without access to healthy foods, access to exercise opportunities, excessive drinking, and food environment index. These health factors collectively concur with findings from other data sources and are indicative of Ulster County's challenges to reduce the number of adults with diabetes. Based on the data collected by the Siena College for the Community Partner Survey, chronic diseases, including diabetes and maternal and child health ranked 2nd and 4th, respectively, for high impact health issues in Ulster County. The county level prevalence of diagnosed diabetes from the 2021 New York State Department of Health report for the Mid-Hudson region shows Ulster County has the 3rd highest prevalence rate below Orange and Sullivan counties. Now, type 2 diabetes is a serious health condition with increased morbidity and mortality risks, but it can be managed by eating healthy meals, limiting calories and alcohol intake, being physically active, regularly monitoring blood glucose levels, quitting smoking, and taking on medications as prescribed. Nevertheless, many affected individuals find it overwhelming and struggle to adhere to their treatment plan. For starters, many individuals are not aware that they have diabetes. Even among those diagnosed, it is common not to experience ill health during the early stages of the disease. As a result, there is no motivation for individuals to make drastic changes to their diet, level of physical activity, or to regularly monitor the blood glucose level, which often is a repetitive and painful routine, or take medications, many of which come with undesirable side effects. And therefore, increasing awareness and education on how to self-manage diabetes, along with active support from the care team, are some of the key activities to help these individuals. For our public health priority 2, we looked at the New York State Maternal and Child Health Indicator Dashboard and data from 2018, the latest available, which show that Ulster County has not met the established maternal and child health 2020 goals and performed poorly compared to New York State in 3 key areas. 1, low percentage of births with early prenatal care. 2, high maternal mortality rates per 100,000 live births. And 3, high rates of almost 3-fold of newborns with neonatal withdrawal symptoms and are affected by maternal use of drugs or addiction per 1,000 live newborn discharges. In April of 2022, New York State Department of Health released the first report by the Maternal Mortality Review Board and Maternal Mortality Morbidity Advisory Council. They found, among other things, Black women continue to die from pregnancy-related causes at higher rates than their peers, 5 times more likely to die. Many of these deaths, about 78% or so, were preventable, and that cesarean delivery has a higher correlation with pregnancy-related deaths than vaginal delivery, 1.7 times more likely to die. Now, cesarean delivery or C-section is a surgical procedure used to deliver a baby. Planning for a C-section might be necessary if there are certain complications in a high-risk pregnancy, or when there is an urgent unsafe concern for mother or baby, and immediate delivery is the only option. While this procedure has saved countless lives, it could carry extra risk and complications for patients. It is therefore imperative that all preventive measures are taken prior to labor to ensure that pregnancies remain low risk to prevent avoidable C-sections. Ideally, then, expecting mothers with low risk pregnancies with the criteria listed here should not have C-sections. Data have shown, however, that this is not the case due to the conversion from low risk to high risk pregnancies. So contributing factors include SDOH issues include none or lack of prenatal care, maternal obesity, maternal gestational diabetes, preeclampsia, preterm labor, and having a history of preterm or early delivery, having a substance use disorder, and having pre-existing medical conditions that can cause maternal mortality. A pregnancy remains low risk when it does not have any active complications or any maternal or fetal factors that would place the pregnancy at an increased risk for complications. In the US, according to a 2021 National Center for Health Statistics report, births by C-section have steadily increased over the last 2 decades, to about 32%, while New York State ranked 12th in the nation at 34.4% in 2017. Data for Ulster counties show similar trends and rates to the national and state data. Moreover, Black and Hispanic women reported higher rates of C-sections compared to white women, indicating maternal health disparities among minority women living in Ulster County. So now let's discuss our proposed interventions. For public health priority 1, our objective is to increase the proportion of people with diabetes who get formal diabetes education by 10% by December 2024. And our intervention is to provide intensive lifestyle interventions education to patients with type 2 diabetes to improve glycemic control and reduce risk factors for cardiovascular disease. We also aim to decrease the percentage of adult members with diabetes whose most recent HbA1c level indicated poor control by 10% by December 2024 by having a diabetes care and education specialist, or DCES, at Health Alliance Diabetes Education Center serve approximately 220 participants annually by December 2024 and develop individualized management plans that fit their lifestyles, beliefs, and cultures. The DCES at Health Alliance Diabetes Education Center will ensure participants understand how to use various diabetic prevention devices like glucometers, insulin pens, pumps, and continuous glucose monitoring devices, and use information from these devices and participants' lifestyles to identify patterns and opportunities for better diabetic management. The specialists will also help participants to develop coping skills to address the daily challenges of the disease, reduce the risk for complications, decrease costs by reducing or eliminating the need for medications and emergency room visits, and help them find and access cost-saving programs. For both interventions, Health Alliance will support its Diabetes Education Center, the only ADA-recognized education center west of Dutchess and north of Orange counties until Albany County, by providing the needed operational resources, increasing community outreach and engagement to raise awareness about the program through the hospital's marketing department, and enhancing internal referral processes from inpatient and outpatient services to increase the number of participants who have poorly controlled diabetes or pre-diabetes conditions. The hospital will also partner with Ulster County Department of Health to promote the diabetes program through their social media accounts. For public health priority 2, Health Alliance aims to decrease low-risk C-section rates to less than 25% from the current rate of 30%, by employing a multi-strategic plan aimed to decrease the low-risk C-section rate and overall maternal mortality in Ulster County. Since 2018, Health Alliance has undertaken vital initiatives to mitigate the reported MCH health disparities in Ulster County. In addition, Health Alliance Hospital Department of Obstetrics and Gynecology, the family birthplace, has partnered with Westchester Medical Center Genetic Consultation Services to provide comprehensive genetic consultation and counseling services via telemedicine, and utilize the Health Alliance Transfusion Center to provide intravenous iron and hydration care for obstetric and gynecologic patients. Through these efforts, rates for first birth, low-risk C-sections at Health Alliance decreased from 40.7% to 29.4% from 2018 through 2021. To reduce the rate of newborns with neonatal withdrawal symptoms, Health Alliance has collaborated with Markville Hospital in Delaware County, another WMC Health Network hospital, since 2020 to offer and continually expand services focused on SUD in Delaware and Ulster counties and surrounding areas through the Neonatal Abstinence Syndrome, or the NAS program. The NAS program aims at assisting pregnant individuals with a SUD. The program employs a wellness coordinator who is stationed at both hospitals and the Bridgeback Methadone Clinic in Kingston during select hours. The wellness coordinator maintains an inventory of baby supplies to be provided to parents with an SUD. Additionally, there are dedicated hospital staff who provide parenting classes, women's support meetings, recovery support, as well as certified postpartum doula services. The staff members can be sought out for recovery support assistance prior to and following the birth of a baby, and act as advocates for the mothers through their prenatal to postnatal journey. Health Alliance plans to continue with this evidence-based intervention and will carry out these specific strategies as follows. 1, enroll obstetric staff to be trained in an interactive online training platforms, Relias, performance modules, which promote vaginal birth and fetal heart rate monitoring. 2, offer expectant mothers prenatal obstetric consultations in addition to patient education opportunities to raise awareness about how to prepare for a healthy pregnancy and to promote natural vaginal childbirth. 3, necessitate the usage of the revised C-section checklist. And 4, to implement peer-to-peer discussions prior to any unscheduled, non-urgent C-sections to ensure evidence-based care practice guidelines. Through collaborations with community partners, Health Alliance will 1, increase the number of expectant mothers enrolled into prenatal care, and 2, link patients to peer support services, postpartum doula care, and referrals and scheduling for MAT, family pantry, transportation links, and housing referrals through the Health Alliance NAS program, addressing maternal and child health, substance use, and SDOH issues endured by this highly vulnerable population. And finally, work with the Maternal and Infant Community Health Collaborative, which is MICHC, through the Dutchess County Family of Healthy Families. This is a program aimed at improving the health and well-being of high-need women throughout their reproductive life years and improving birth outcomes. And the Public Policy and Education Fund of New York, which is PPFNY, by working with the New York State Certified Community Healthcare Navigator in Ulster County to enhance community outreach efforts and to serve as a resource for these expectant mothers. And that I am finished with my presentation. Thank you very much, and I am ready for questions.
Thank you so much, Dow. I think that if you have questions, please add them to the chat. One of the things that came to my mind just listening to your presentation is, of course, all of the obstacles with insurance and care. And maybe if you can address, in particular with, well, with everything, I guess. Insurance is everything. So.
Yes, it's very interesting you brought it up. Actually, we had a couple of calls with one of our funders, HRSA, about how the COVID-19 is actually, today is the last day to be considered as a public health emergency. And there are people who are already receiving Medicaid will now no longer be eligible because of the stoppage of the COVID-19 funding. And so health insurance came up a few times, and across our programs with the care coordination, when possible, we link people to Medicaid. We are a safety net hospital. We serve patients, regardless of needs. Most of our patients are in fact Medicaid patients, but we also have uninsured patients as well. But like I said, across our network, really, when there are chances for us to talk to people about Medicaid, except for going through this phase, for example, they call it unwinding period. We link them to make sure that they know how to apply for Medicaid, make sure they know how to update information with the Medicaid offices so that they can stay in contact with the latest news and policies, or if they're not qualified, then try to help them find other alternative insurance that they could join. But good news is New York State, some state they stopped as of April, some states stopped as of May. New York State is actually one of the states that stopped later, and I think July is when this policy is going to affect.
Great. Thank you for that answer. We do have another question from Marge Gagnon. What is currently happening in Ulster County to increase community outreach for pre-diabetic awareness and outreach?
So that is our diabetes center at Health Alliance. When there are community events, we try to be there with different health fairs, farmers market. It's near Marketville, so when we do these community outreach, we try to go together across different programs and things like that. The folks there are, we have fewer. I think the last couple of years we've lost. I guess the number of staff has reduced for different reasons, but now we are trying to increase the number of staff so that we have the human capacity to go out and do more outreach. And also through this program, we also want to reach out to local, healthcare providers for them to be aware of this available program so that they can refer patients to our program as well, internally and externally.
Right. Melinda, do I have a couple of minutes just to talk to that issue or no? This is Marge.
Yes, you can just ask something very direct. We're at time.
So I'm a registered nurse, and I've had multiple contacts with the diabetes center, and as far as I'm aware, it's almost, I have not seen them out in the community. I also have tried to make myself available to them if there's a community outreach that I can help them with. I work with the District 20 Alliance group, and one of their missions is diabetes outreach and education. And so I need to have more information, again, I guess, directly from them so that I can help with this initiative.
That's great. If you don't mind, if you can share your information with me, I will connect you to the director of the center there. I'm
corrected. I'm corrected with the center there. I know her personally. Yeah.
Okay. So then that will be more on their end. If you want us to meet together to, things are getting warmer. We actually, planning more and more community events, as for the spring and for summer and then into early fall. Like I say, staffing has been an issue in the last year or so, and then also because of COVID. But I know we're trying to expand the workforce there. So if you still have issues, I can certainly
if she could reach out, if she could reach out to me about where these events are, I could possibly even help staff them, is the point I'm trying to make.
That'd be great. Yes. Okay.
So this sounds like a conversation that you might continue after the meeting.
Right. Yep.
Does anyone else have any other questions to add in the chat for Dow? Okay.
There is one more question from Kristen Kessler.
Oh, great.
In the chat.
That.
Yeah, absolutely. Would you like me to?
So Kristen asked if to make food behavior changes to help manage diabetes, it's highly dependent upon access to nutritious foods that are safe and appropriate for that health condition, something that many people do not have. With that in mind, will you and how will you screen your patients in these programs for food insecurity? Will there be enhanced support in connecting them with food and other resources that address social determinants of health?
Yes, so again, and I'm coming back to this COVID-19 funding being stopped. One of the issues that we've heard from patients and people in the community is that food costs are increasing. They're losing their SNAP, funding. And so this is a huge issue. Again, across our network, if there are resources locally, there are certain things that our hospital cannot take on. We cannot take on, and we are being very honest about this. We are a healthcare provider. We can screen for social determinants of health, and we can provide care, some sort of care coordination, but ultimately we cannot be the social service provider. So when we do find services, we do link our patients there. If you know of other resources that we should be aware of to include in the resource guide, or to inform our providers on how to share this information with our patients, we would love to hear that. But yes, that is, I mean, healthy food actually, not even just healthy food, just food in general. Things are very expensive, and people are struggling. So yes, we are aware of that.
Yeah, I think just to follow up on that, there are probably a lot of agencies and organizations that have programs and also education to provide on food that we'd love to, all of us would love to be able to connect with the Health Alliance to make partnerships. So it sounds like we have some opening to reach out to you and at least share what's going on. So thank you so much for a really great presentation. We're going to move on into our next presentation, which, before we do that, we have a very quick poll. So you're going to see a poll come across your screen. It's just 3 short questions. They're yes, no, or maybe. And this helps us evaluate our program today. So quickly just take the poll, and once we see everybody's done that, we'll move on. We'll give it just another, we're almost there. Almost all of you have had a chance to do it. You should see a poll on your screen. And I would say we're probably there, Ninette. Okay. And if we close down the poll. Oh, not sure what just opened up. Okay, I'm going to stop sharing and reshare. There we are. So we have just moving on into our next presentation. And we're going to introduce Vin Martello, the Director of Community Health Relations at the Ulster County Department of Health, and Ellen Reinhard, the Director at TFAC, Tobacco-Free Action Communities in Ulster, Dutchess, and Sullivan. They'll be speaking today on tobacco prevention, progress, and strategy. And it's just no small coincidence that the PowerPoint, a few of us are all wearing turquoise, because this is Turquoise Takeover Week, and we'll be hearing more about that right after this presentation, and that also has to do with tobacco prevention. So I'm going to let Vin and Ellen take over and share their presentation. And I believe I need to share your presentation for you. So let me just make sure that I've got that up. There we go, that's the right one. Okay, so let me just move everybody around and from the beginning. Okay, just let me know when you want to advance the slides, Vin.
Good afternoon, everyone. As Melinda said, I'm Vin Martello. I'm Director of Community Health Relations for the Ulster County Department of Health. And along with Stacy Kraft, we run the Health Education Division here, which not only goes out and does live presentations on a variety of health topics, but we also do all the outbound messaging and radio, TV, billboards, bus ads, social media. We've done mobile apps. We also convene a lot of different coalitions. This is one that we sponsor. We created the first opioid prevention task force, and we generally keep an eye on population health data and statistics to help make sure that Ulster County is moving in the right direction. I also want to acknowledge Dr. Carol Smith, who's joined us on the Zoom here, and also Ellen Reinhardt. I'll let her introduce herself. Ellen.
Okay, sure. Hi, everybody. I'm Ellen Reinhardt, Director of TFAC, which is Tobacco-Free Action Communities in Ulster, Dutchess, and Sullivan. It's a program at Health Alliance Hospital, which is a member of WMC Health Network, and is one of 21, I think it is now, advancing tobacco-free communities grants throughout the state. And we are all funded by the New York State Department of Health Tobacco Control Program. We have core initiatives, which include reducing tobacco marketing in the retail environment. We promote tobacco-free outdoor spaces and increase the availability of smoke-free homes. So our objective within these initiatives, we educate, we engage, and we empower the community to work together towards policy change.
Next slide, please. So why do we focus on tobacco prevention here at the Health Department? Pretty obvious, but also backed up by the data that 4 out of 5 leading causes of death in Ulster County are smoking related. The 5th one, which is unintentional injury, includes all the drug related fatalities, the opioid epidemic and what have you. So it is a worthwhile investment of time, energy, and resources on a lot of different levels. And we'll go into that a little bit more in subsequent slides. Next, please. Next. So low-income households in Ulster County have a significantly higher rate of smoking, and Ulster County taxpayers pay the price. So you can see here that the Mid-Hudson Valley average is 18%. Ulster County's average by TFAC's latest survey is 21%. That's the adult smoking rate. But if you look at the households that are under 25K annual income, that's 31%. And so not only does it influence all of the smoking related diseases, but if you look at chronic diseases across the board, you will find that low income and minority households have a much higher rate of all manner of chronic diseases and certainly smoking related ones. And tobacco companies, as we'll talk about a little bit more, really target minority and low income households in a lot of different ways. We'll talk about that a little further in, but from a fiscal point of view, not only is this a health issue, but from a fiscal point of view, Medicaid, which provides low-income medical insurance to the same population that has these high rates of smoking and chronic disease, the total cost in Ulster County, the total cost is $1.3 billion a year. The local taxpayer share is $40 billion a year. I mean, $40 million a year. So, and New York is the only state in the United States that requires counties to pick up a local share of Medicaid expenses of 3% of expenses, and that equals $40 million a year. So the extent to which we can reduce chronic disease and reduce smoking-related diseases will have an economic benefit as well to taxpayers. So this is a quick review of our tobacco prevention policy in Ulster County. And Ellen, you're welcome to join in, chime in anywhere along here. So in 2008, Ulster County prohibited smoking on all county property, and vaping was added in 2016.
And then this also includes, when you talk about county properties, it includes SUNY Ulster Campus and the Ulster County Fairgrounds. So it's a very great, comprehensive, all-inclusive policy that the county adopted back then, and they really took a leadership role. Ulster County became a leader in tobacco control, starting with this.
Right, and Ellen and I worked very closely together with our colleagues, and in 2011, we worked with all Ulster County municipalities to prohibit tobacco use in all public parks and playgrounds, which was
right.
really...
And the point of that was to eliminate and prevent exposure to secondhand smoke, to cigarette butt litter, and to denormalize tobacco use. And like we were talking about with vaping, many have added vaping to this policy as well. So it's really a great comprehensive. Some of them adopted local laws and some policies. So it depends on which town or municipality, village and the city of Kingston had adopted just a kind of a smaller policy, but then really made it 100% down the road. So.
And then the next one in 2015 was in response to the fact that even though tobacco companies are not allowed to advertise in the broadcast media, they still spend $2.5 million a day in New York State alone, aggressively marketing their products. And the way they do that is at point of purchase in the corner stores and the convenience stores that our kids frequent. So there's a real need, there's not less of a problem with youth purchases of tobacco products, although we have a separate law for that, the Adolescent Tobacco Use Prevention Act, and the health department enforces that. But kids are exposed to a tremendous amount of marketing in these stores. You'll see, like if you go into the Quick Checks of the world or others, you'll see that some of these vaping ads, they have these kiosks that are right at eye level for young people and signage all over. So what we did, we were one of the first counties, I think the first one in New York, and maybe among a small handful in the United States, to create a separate county level of retail licensing to sell tobacco products and to prohibit the issuance of any new licenses to sell tobacco products within 1,000 feet of any K through 12 school in Ulster County, thereby reducing the exposure of tobacco marketing to our young people.
And again, Ulster County was and is still a leader in New York State by doing this. The only other tobacco retail licenses there are in the whole New York State is Dutchess County and New York City. So Ulster County really hit it out of the park when they did this, because Dutchess has a retail license, but they have nothing included in it right now. And they're working on doing what Ulster did and having the no new retailers within 1,000 feet of schools. Because tobacco marketing, like the big wall, like Vin was saying, when you go into the stores, you see behind the registers, it is a primary cause of youth smoking. And also it's a major barrier for smokers who are trying to quit. They see that and it makes them want to smoke a cigarette. So kudos to Ulster County for doing this.
And in 2018, we were the first in New York State to raise the age to purchase tobacco products from 18 to 21, which is also a big win. And when you think about the adult smoking rates and you say to yourself, boy, they're awfully high. And then you think of how much more difficult is it to get addicted adult smokers to quit smoking, or addicted adult, substance users of any kind, than to prevent young people from experimenting with tobacco products and drugs in the first place. Vastly more expensive, vastly more complicated, and vastly less successful to do it when they've already reached adulthood. Next, please.
And this law was important too, Vin, because 95% of all adult smokers start smoking before the age of 21. So raising the legal sale age of all tobacco products to 21 is a really critical step, because we can help reduce tobacco use by doing this. And since Ulster County had done that several years ago, New York State has recently passed, a couple of years ago, the Tobacco 21 statewide.
And so, I went over this earlier, tobacco companies continue, they said back in the 1990s that they didn't market their products to kids. We don't market our products to kids. Yet in 1998, when all of the state's attorneys general sued the tobacco companies, the tobacco companies were required to turn over all of their documents and their research and their memos and everything. And thousands of documents talked about recruiting new smokers, which is a catchword for young people, because when you think about it, for tobacco companies, their older customers are literally dying as a result of using their products. So unless they go out and recruit new young smokers, they're out of business. So, and then they added on to that, creating the vaping epidemic, which, became a huge epidemic among high school students and still is. Next slide, please.
And also I want to add too that, tobacco companies spend $8.8 billion a year. That's more than $24 million a day, every day in the United States to market these products. And mainly the marketing is in stores where our kids shop. So tobacco marketing is a cause of youth smoking, and kids are like 3 times more sensitive to tobacco marketing than adults. So it's very important that we remove tobacco marketing in our stores.
So one of the provisions of the Tobacco Youth Marketing Law, which established a county level of licensing and prohibited any issuance of new licenses within 1,000 feet of a school, is that existing retailers were grandfathered in and could and as a result of pretty much political compromises at the time, an existing license could be transferred to a new owner as long as it's at the same location. So if an existing retailer at that time wanted to sell his or her business to a new owner, the new owner was entitled to apply for a license and receive a license. So that was something that we are trying to correct, and we'll talk about that. Next slide, please.
And also the U.S. Surgeon General's report confirms that the counties and the communities that allow retailers to sell cigarettes and other tobacco products near schools have a higher rate of youth smoking than the communities that have tobacco-free areas around school. So, the tobacco industry is very smart with those posters and the bright colored displays, the power walls behind the counter. And so it's very effective to gain those new smokers, those kids, because they cannot stay in business unless kids smoke.
So the advantage of our existing law is that it did prohibit the issuance of any new licenses since 2015, which meant there weren't more tobacco retailers located around our schools. But the drawback was that it didn't reduce the volume and density of existing tobacco retailers in school zones. Only over time, it just held it steady. We think that now is a great time. We have a legislature that we think is much more open-minded with respect to, critical public health issues and youth protection and so on. So we think that this is a time to advocate for amending the law to not allow existing retailers to sell, to transfer the rights to have a license to the next owner, but that the license would basically be retired once that business was either closed or sold. The other thing that we're talking about, and we put both of these in our community health improvement plan measures, which you'll see, is that flavored tobacco products really disproportionately target youth and low-income and minority populations. For instance, 86% of all menthol smokers are African-American population. So tobacco companies target, as you can see from the statistics in low-income and minority neighborhoods, tobacco companies target minority and low-income neighborhoods with a huge amount of outdoor advertising, point-of-purchase advertising, what have you. And then to flavored tobacco products certainly appeal to youth. In fact, flavored vaping products are now prohibited by law in New York State, but flavored tobacco products are not. So you'll see that in the measures that we put into the CHIP, we included amendments to the licensing law that would, one, retire a existing tobacco license once a business is sold or goes out of business, and two, that would ban the purchase of all flavored tobacco products in Ulster County. Next slide, please. Again, so these are the two recommendations. Again, both are supported by New York State Department of Health, Tobacco Control, and by the CDC.
And so the average age of a new smoker in New York State is 13 years old. And like Vin was talking about statistics recently, research indicates that more than 80% of youth who have ever tried tobacco, they say they started with a flavored product, including menthol. So we've got these smokeless tobacco, cigars, cigarillos, and they have a wide variety of fruity flavors and sweet flavors. So that's really what attracts kids, and the nicotine in them addicts them.
Next slide, please. So our recommendations are really a win-win scenario for Ulster County. Why? Because it provides enhanced protection for our kids. In fact, TFAC's survey in 2022 said that 70% of Ulster County residents support added restrictions in school zones. As I mentioned earlier, there's significant Medicaid cost savings for taxpayers over time. So let's say that, so we know that the local taxpayer share of Medicaid expenses, local taxpayers, all of us who live in Ulster County pay, is over $40 million a year. If we could make a small dent in that, let's say we were to make a 10% difference in that, that's $4 million savings right there. Not to mention all of the, the other costs that are associated with smoking, in private insurance and so on. And Ulster County can become one of the first counties in the nation to ban the sale of flavored tobacco products and address a significant health equity issue and social justice issue, because it is targeting low-income individuals, it is targeting minority populations, and targeting our kids. All three groups are highly vulnerable. Next slide, please. So, focus area 3 in the New York State prevention agenda is prevent the initiation of tobacco use. And these are the bullet points that exist under that, that goal, and that's decreasing the prevalence of tobacco use by high school students, combustible cigarette use by high school students, prevalence of vaping products by high school students, young adults 18 to 24, vaping products between 18 and 24. So, and the last one, we increase the number of municipalities that adopt retail environment policies, which we already have. So what we're calling for is an amendment to make that part of it even stronger. Next slide, please. So, again, you can see that in both of these, our recommendations fit squarely into these goals of preventing the initiation of tobacco use by strengthening the law to reduce the density and number of tobacco retailers in school zones, and to ban the sale of all flavored tobacco products, including menthol, to protect youth and low-income youth and prevent them from becoming adult smokers, but also to protect adult, minority, and low-income populations who have the highest rates of smoking-related diseases and other chronic diseases. Next slide. So the input measures, which Stacy helped develop for all of the partners that submitted items for our community health improvement plan. So the input measure is mobilize 2 community partners to publicly support tobacco retail initiative through distributing education materials, post on their social media and websites, and meet with elected officials. And we'll talk about that more in a second. And output measures, youth-focused representatives coordinating efforts with TFAC and Ulster County Department of Health to attend 3 meetings with key legislators. And I want to say that looking back to that law in 2015, the tobacco youth marketing law that established the retail licensing and prohibited new licenses within 1,000 feet of schools, that law and the raise the age law from 18 to 21 were both accomplished with broad-based community support. We mobilized, Ellen and I and our colleagues mobilized youth groups. We actually had youth testifying at the public hearings in front of the legislature. We got schools involved. We've got youth groups involved. We got parent groups involved. We got the medical community involved. And it was really a community-wide advocacy effort for, a very, very worthwhile, two extremely worthwhile accomplishments. And now we want to build on that core foundation and that core strength to even protect our community and our kids and our population even further. Next message, next slide, please. Short-term outcome. So identifying community and policy champions who are willing to work together. And then intermediate outcome, the number of policymakers who have agreed to support the law revision. So what we're going to do, we put these recommendations in our community health improvement plan. Next steps will be to really work with the county executive's office, county leaders, county policymakers, county advocates, relevant stakeholders to really push these measures forward and really strengthen our prevention activity. Next slide, please. So Ellen, I'll let you take this part because this is squarely in your wheelhouse.
Okay, so we just spoke about the retail environment and kind of an overview of tobacco, but the TFAC grant is also working on two other initiatives that are important to the communities, and one is smoke-free multi-unit housing. And with this initiative, we assist landlords and property managers and tenants to create smoke-free and aerosol-free home environments with a focus on low-income and affordable housing. So we do this, we reach out through letters and phone calls and emails, and we educate about the dangers of secondhand smoke. And we offer to provide some technical assistance to these property managers and landlords. And what we offer would include like presentations to housing boards and management, sample tenant surveys and sample leases upon request. They have to request us to give them that kind of thing. We also provide free signage and window decals for our buildings and for all the apartments that do this. We connect them to the state smoke-free housing registry, which is smokefreehousingny.org. And we also offer cessation resources like the New York State Smokers Quit Line. There's another arm of our program, which is health systems for Tobacco-Free Hudson Valley, and Center for Tobacco-Free New York is part of that, and they are our partner in this. We work with them on cessation efforts and that kind of thing. So it's really a well-rounded program. So now I'm showing you the smoke-free housing outcomes for Ulster County. They're moving forward. Since the last prevention agenda of 2019 to 24, that CHIP cycle, 973 additional smoke-free apartment units, of which 823 are low-income units have been added to our grand total list of 2,517 smoke-free apartments in Ulster County. And of that, 2118 of those are protecting low-income residents.
I think it's important to note here that the New York State Clean Indoor Air Act does not apply to residential apartment buildings. And it's also important to note that the overwhelming evidence demonstrates that landlords are very supportive of smoke-free housing initiatives because of the added expense that they have to incur for when there's a transition in tenants, when they move out of an apartment, the additional cleaning costs and the additional painting, whereas it might take 1 or 2 coats of paint in a non-smoking apartment. For a smoker's apartment, it might take 5 coats of paint to get rid of the smell and get rid of the stains on the walls and what have you. So, it's very important. And it's very important because children and others who have no choice about, whether to breathe the air in a smoking building. And the research also indicates that a large portion of the air that circulates throughout a building is recirculated so that, and that permeates through the floors and the fixtures and what have you, exposing everyone to dangerous secondhand smoke.
And we get calls all the time from tenants begging us for what can we do to help them, because they go into their closet, they go into their bedroom, and they can't even stand it because the smoke is so bad, the smell and the secondhand smoke, thirdhand smoke, their kids' rooms, and it's really that's why this initiative is so important. And also, Vin, you mentioned about the cleaning of the apartments, also fires. There's a big fire hazard with tobacco use.
So I got a note from Melinda saying we're running out of time. So next slide, I'm not sure what the
okay. Next slide is just an overview of our tobacco-free outdoors. So we work to eliminate that, and again, we talked about at the beginning about the cigarette butt litter and the denormalizing tobacco use. And we have all counties in Ulster County now have adopted some sort of tobacco-free outdoor policy for their parks and playgrounds. So, and that's, I think.
I think that's the end. The next slide.
There's one more about and reality check. So we talked about youth, and we, along with community engagement for TFAC, we also have a youth action program branded Reality Check. It's a youth-led, adult-supported movement in New York State, and it empowers youth to become leaders in their communities, and exposing the deceptive marketing of tobacco. And we do things, community events, movie events, meeting with lawmakers, writing letters to the editor. It's really great. It's a peer-to-peer. They develop a peer-to-peer education program as well. So that's really a nice arm of our program as well. That's, I think, the last one.
Yes.
Oh, well.
Thank you. So I'm sorry we went out over by a few minutes, but a lot of information here.
It is, and actually you have a couple of questions, and I think they're very similar. So Ellen, this question's for you from Samantha Black, and actually Christine Noble had the same question. Do you have a list of smoke-free housing options in Ulster County? And Christine also emphasizes, especially for seniors.
Yes, we do. Actually, on that smoke-free housing NOA website that I talked about, there should be lists of all housing in every county in the state for smoke-free options. And if you want to know more information, you can always go to our website and contact us through that, and we can get you more information.
That's great. Thank you both so much. That was really a fantastic presentation. Before we launch just the quick poll that we're going to go into, just to evaluate your presentation, I also wanted to share that we have opportunity going forward for collective action on some of these policy changes that Vin has been talking about, in particular the flavored tobacco. And we've done this before as a Healthy Ulster Coalition at the council. We provided a letter back in 2018 supporting the change in age from 18 to 21. And we also presented on behalf of the council at the legislature at the time, just advocating for that change. We have that opportunity ahead of us, and we'll be talking more about that going forward via email and also at our next meeting in July. So I just want to thank both of you for all of your presentation. We're going to launch another very quick poll. Questions will be very similar.
Before we do that, there's just a couple more questions in the chat.
Oh, they weren't there when I looked before. Go ahead and read them, Nanette.
So Veronica asks if she wonders how you approach property managers at apartment complexes. Do you approach them, or do they normally come to you? She's just curious about how that conversation is initiated.
Well, at the beginning, it was mostly we were really reaching out and approaching them. And now it's evolved. More and more of apartment complexes reach out to us, and they want to know what their options are and what they can do. A lot of people don't realize, they have the right to develop a policy, just like